Project Shunt started in 1997 when we were approached by Healing the Children, which is an international aid organization that provides medical care to children. They really had a great need for neurosurgeons and neurosurgical care, particularly in Guatemala. They have a very high incidence of spina bifida. Working with the Pediatric Foundation, and particularly with some of the physicians that are associated with that, we've been able to train some of the general surgeons in techniques regarding some very basic kinds of neurosurgery. We operated in what I would consider really pretty harsh environment. What we had was one closet-size operating room and one slightly larger room. We had operating tables that were essentially just gurneys. We had a sink that had only cold running water and only that a couple of hours a day, and we had to bring everything else with us. I think for me as a neurosurgeon, and particularly a pediatric neurosurgeon, I wanted to make certain that the kids that we took care of were going to get the same quality of care that they get at Mott Children's Hospital. And so we tried to focus the kinds of operations that we would do and the kind of care that we would give both preoperatively and postoperatively. In the process of this, I think all of us have learned just how wonderful it is to be a physician, and more importantly have sort of gotten back to the reasons why we became a doctor to begin with. I think the educational process has been two-way. We've learned what we need to do as surgeons, but they've also taught us to be able to understand what is necessary in an operating room. And it's really helped us, I think, hone some of our skills. I think my patients that I take care of here in the United States that have spina bifida get a better operation for the fact that I have such familiarity and experience improved upon because I've been down to Guatemala and operated so extensively on a variety of these things when we do our medical mission.
I definitely learned from this trip that I can get something more out of volunteer work than I could during my prescribed daily activities as a neurosurgery resident, and I think it's sort of opened the door to doing more medical missions in the future. There's definitely a lack of neurosurgical care both in this country and globally, and I think missions like this can kind of close that gap. Going to a third world country is certainly a unique experience. You get to see abject poverty that you wouldn't see on a normal daily basis here. It looks like, you know, the place is crumbling. At the same time, it's a very vibrant environment. The population is very active and young and out and walking places. I was involved in about 14 surgical cases when I was down there, and they included some of the most complex spina bifida repairs that I'll do as a neurosurgery resident. And in addition, we did a number of shunts, which are routine operations for us that we can do as residents with minimal staff supervision without too much difficulty, but they'll change the course of a patient's life. Those kids will have a chance at normal neurological development that they wouldn't have otherwise had. Going on a medical mission like this is an experience that can broaden your horizons in a way that they can't be from any work that you do domestically in-house. You're going to see things that you would never see in this country on a daily basis down there. I feel like every opportunity I have to go down there, I learn something, and it's very meaningful for me to have the opportunity to take care of Guatemalan children. We're trying now to be able to look at other ways in which the University of Michigan can integrate itself into the basic healthcare delivery system that is there within Guatemala, not only making use of the Pediatric Foundation, but of governmental structures as well. The most important thing we can do is recognize that the solutions for a given country are perhaps not the same solutions as we would have in the United States, and so it's very important to have strong partners at the other end.